Hello everyone, and welcome back to episode 27 of the Sex Advice podcast. I'm your host Abhishek, a specialist pharmacist in HIV and sexual health. In our previous episode, we've shed light on TLD, a single tablet regimen used widely in the developing world for the treatment of HIV. Today, we're shifting our spotlight onto Biktarvy, another groundbreaking single tablet regimen that's been making waves in the HIV treatment landscape. Biktarvy is a formulation that combines three drugs: Bictegravir, Emtricitabine, and Tenofovir Alafenamide. It is used as a first-line treatment for many living with HIV in many parts of the world, providing the convenience of a once-daily pill and a relatively good side effect profile. Let's think about Josh for a moment, a young, vibrant, 22-year-old gay man from London who loves theatre. Right after finishing art school, he's been busy chasing his dream of making big in the world of theatre. Josh's dreams are huge. He envisions himself on grand stages, captivating audiences with his performances. However, amid his hopes and hard work, he learned he has HIV. With his busy schedule, often missing meals, and sometimes having to travel suddenly, Josh can't manage a complicated HIV medicine routine involving multiple pills. Josh needs a treatment that aligns with his aspirations, a regime that doesn't slow him down, and is independent of his chaotic lifestyle, yet remains a potent shield against HIV. Enter Biktarvy, a paradigm shift in therapeutic landscape. This pill makes the medication routine into a straightforward single step. For individuals like Josh, Biktarvy offers the gift of simplicity in their battle against HIV due to the convenience of a one-tablet regime combined with better tolerance, less demanding scheduling, great safety profile, and above all, robustness against the deadly virus. Now, if you or someone you know who is currently taking Biktarvy, it is crucial to understand the nitty-gritty of it, to take full advantage of its benefits and effectively manage any potential side effects. You should have a solid understanding of how to use it. So, let's look into Biktarvy in a bit more detail. The optimal time for taking Biktarvy is once daily, with or without food, at around same time every day. A couple of hours here or there will not make a huge difference in the grand scheme of things. The tablet should not be crushed or split in half, but swallowed whole. Biktarvy is generally well tolerated, but it does have its share of side effects. Side effects are your body's way of saying that it's adjusting to the medication. These side effects are typically most noticeable when you first start therapy and generally decrease over time as your body adjusts to the medication. And for all you know, nothing might happen to you. However, if any of the side effects persist and become bothersome, contact your pharmacist or doctor to talk about side effect management or other suitable alternatives. The most common side effects are headache, fatigue, dizziness, abdominal pain, indigestion, nausea, and vomiting. Speaking specifically of nausea and vomiting, if you vomit within an hour of taking the tablet, take another tablet and then take your next dose as usual the following day. In certain group of patients, Biktarvy is known to cause weight gain. The exact mechanism behind this observation is currently unknown and remains an active area of research. Hence, for those on this treatment, it is recommended to routinely monitor your weight. If you observe a significant increase that worries you, it is crucial to raise your concern with your doctor. Remember, your treatment should be tailored to your unique needs, and there are other equally effective alternatives to explore. Now, let's look at what to do if you miss a dose. If you forget to take Biktarvy and notice within 18 hours of your usual pill-taking time, then you take the tablet as soon as you remember it. Then take the next dose at your usual time the following day and carry on. However, if you notice after 18 hours of your usual pill-taking time, then do not take the missed dose. Wait and take the next dose at your usual time the following day. The important thing to note is not to take double dose the following day to make up for the missed one. On the flip side, if there is a rare event where you overdose on Biktarvy, it is essential to seek medical help immediately, especially if you are experiencing side effects. Let's now look at another important aspect of taking HIV medication called drug interactions. Biktarvy can sometimes interfere with how other drugs work and vice versa, a phenomenon called as drug-drug interactions. These include, but not limited to, metformin, which is used for diabetes, certain anti-seizure medication, calcium or iron supplements, antacids or other indigestion remedies, and certain antibiotics used against tuberculosis like rifampicin. Hence, it is absolutely vital to make your doctor and pharmacist aware of any other medication you take, including over-the-counter medication, vitamin supplements, herbal products, and even Class A drugs like cocaine, ecstasy, crystal meth, etc., to ensure that they are compatible with Biktarvy. Remember, it is in your best interest to ensure that these interactions are effectively managed, as this will contribute to the effectiveness of your treatment and your overall health. It is also vital to note certain other considerations when taking Biktarvy or indeed any antiretroviral therapy. When it comes to consuming alcohol, caution is advised, as heavy drinking may impact adherence and can also make it more difficult for the liver to process these medications. As for pregnancy and breastfeeding, if you are on Biktarvy, it is crucial to have a thorough discussion with your doctor to ensure the safest route for both you and your baby. Biktarvy's introduction and widespread adoption have been a testament to the ever-evolving and improving landscape of HIV treatment. Its efficacy, combined with its convenience, underscores the great strides we've made in HIV care. So, that's it, folks. I hope this discussion about Biktarvy has given you some valuable insights. Armed with this knowledge, you are better equipped to navigate your HIV journey. However, a final word of caution. This episode is meant to inform and not substitute professional medical advice. Always consult with your healthcare provider for any health concerns, and do not stop taking your tablets or make any changes to your regimen based on something you have heard here. If you believe that you have a medical emergency, please seek immediate attention from your doctor. In our upcoming episodes, we will continue to explore other treatment options and strategies in the world of HIV. Remember to follow us on Twitter at RealSexAtBites and me personally at PharmIDExpert for more updates. Until then, stay curious, stay informed, and most importantly, stay safe. I'm your host Abhishek, and I'll see you in the next episode.